In this video, we are going to discuss about the pelvis and perineum. So first we need to understand the pelvic inlet and the pelvic outlet, and also the boundaries of pelvic inlet and outlet. So first we'll discuss about the pelvic inlet. So if you see, this is a pelvic inlet shape. Its anterior border is having pubic symphysis. Okay, so pubic symphysis is between two hip bones. Okay, so this is the sides of the hip bones, and posteriorly you will have sacral promontory. So sacrum have sacral promontory like this, right? So imagine this as sacrum. This is pubic symphysis. So anteriorly pubic symphysis, posteriorly promontory of sacrum, and on the lateral border you have iliopectineal line. So iliopectineal means from the ilium bone to the pectineal line is present on pubis bone, right? So iliopectineal line is the lateral border. No need to know about the medial border. So these are the three borders. So regarding the pelvic inlet, we need to remember the three borders: anteriorly pubic symphysis, posteriorly is promontory of sacrum, laterally iliopectinate line. Now coming to boundaries of pelvic outlet. So the pelvic outlet is nothing but the perineum itself. If you see the pelvis bone from the lower side, that is the pelvic outlet, which is also called as perineum. So if you see the perineum, it is like a diamond shape, and this perineum anteriorly is the same, it has the pubic symphysis, but posteriorly if you see, it is having coccyx. So posteriorly at the pelvic outlet or perineum, it has coccyx, and anteriorly pubic symphysis. Okay, so here also the same thing, anteriorly pubic symphysis, but posteriorly it has sacral promontory. As this is, you are seeing from the lower side, posteriorly it will have coccyx. So now if you see posterior laterally means there is a sacrotuberous ligament. So this is called as sacrotuberous ligament, which is present posterior laterally. It is present posterior and also laterally. Okay, sacrotuberous ligament. And next you have anterior laterally. Anterior laterally there is ischiopubic ramus, that is between the ischio and pubis bone you have a ramus. So ischiopubic ramus is anterior laterally, and all others we have already discussed. So now this posterior part is divided into an anal triangle, and this anterior part is divided into urogenital triangle. In the anal triangle you have an anal orifice. Okay, and surrounding that you have a fat tissue, that is ischioanal, or also called as ischiorectal space. You can call it as ischioanal space or ischiorectal space. And in the middle you are having a transverse perineal superficialis muscle. So actually the muscles which you see now from outside in the pelvic outlet, they are called as superficial rectal space or superficial muscles. Okay, so they are the superficial muscles, and they will also be the contents of superficial perineal pouch. Actually we have superficial perineal pouch and deep perineal pouch. The superficial perineal pouch contents are nothing but all the muscles, all the structures which are present over here on this superior surface. Okay, so once again let us revise the pelvic inlet and outlet boundaries. So inlet boundaries are pubic symphysis anteriorly, posteriorly sacral promontory, laterally iliopectineal line. Coming to this boundaries of pelvic outlet: posteriorly coccyx, posterior laterally sacrotuberous ligament, laterally ischial tuberosity, anterior laterally ischiopubic ramus, anteriorly pubic symphysis. Okay, so now let us discuss about ischioanal space or ischiorectal fossa. As we said, the side of anal orifice is called as ischioanal space or ischiorectal fossa. So the ischiorectal fossa boundaries you can see clearly in this diagram only. Anteriorly it is having transverse perineal muscle. This one is transverse perineal superficialis. Okay, and posteriorly you can see clearly there is a sacrotuberous ligament here posteriorly. Okay, and medially there is levator ani muscle. So for that you should see this diagram. In this diagram, this is a rectum, this is an anal canal, and this is a levator ani muscle, and this is a lunate fascia here, and this is a perianal fascia, and here you have a canal that is called as Elox canal, or also called Purental canal, and this is obturator internus muscle. So if you see medially to ischiorectal fossa, so this is ischiorectal fossa. So medial to it, what you have? Levator ani muscle. Okay, and laterally you have obturator internus muscle, and also the fascia over the obturator internus muscle, and also the Elox canal or Purental canal. So these are the lateral boundaries. So now let us see some more detail of Ehlers canal or pudendal canal. So Ehlers canal, also called as pudendal canal, okay, or pudendal fascia. So lateral wall of ischiorectal fossa, it is nothing but it's a lateral wall of ischiorectal fossa. It is 2.5 centimeters above ischial tuberosity. Okay, this is important point, and it is mainly formed by splitting of fascia over obturator interus, lunate, perianal fascia. You can see clearly. Actually, mostly it is formed by ischiorectal fossa only, but it is formed by either obturator internus or lunate and also perianal fascia. Okay, and it is extending from our lesser sciatic foramen up to deep peroneal pouch. So what they are saying, this Ehlers canal, it is extending from lesser sciatic. If you see this diagram, you'll understand. This is the pudendal canal. So you can see this is the lesser sciatic, this is greater sciatic foramen, this is the lesser sciatic foramen. So from here the pudendal canal is passing like this, and it is in turn divided into perineal nerve and dorsal nerve of penis. Okay, so this is the pudendal canal, and also it is giving inferior rectal nerve as its branch. So the pudendal, you can see it is extending from lesser sciatic foramen, okay, up to deep peroneal pouch. So it will go deep into deep peroneal pouch. The contents of pudendal canal are in the pudendal canal along with the you'll have pudendal nerve. It gives two branches in pudendal canal. One is the perineal nerve, one is the dorsal nerve of penis, as I shown now. And also there is internal pudendal artery, internal pudendal vein. That is nothing but internal pudendal vessels. So what are present in the pudendal canal? So pudendal canal have pudendal nerve. Along with pudendal nerve, they also have, so this is pudendal canal. In the pudendal canal, you will have pudendal nerve, and also you will have the dorsal nerve of penis. Pudendal nerve will divide into perineal nerve and dorsal nerve of penis. And also there is internal pudendal artery, internal pudendal vein. You can see clearly. Okay. So next, suprategmental space. So actually, if you see here above the ischioanal fossa, here you will see a suprategmental space. So the suprategmental space is just above lunate fascia. This is the lunate fascia. So above lunate fascia. Now coming to hiatus of squamon. What is this? This is a gap between the levator ani and obturator internus. Sometimes there will be a gap between levator ani and obturator internus. No fascia here. Then that is called hiatus of squamon. So now coming to IRS. IRS is what? It is a IRS means ischiorectal space or fossa. Space or fossa, you can put it any name. So ischiorectal space contains, so what are present in it? There is inferior rectal nerve or inferior rectal artery. You can see here inferior rectal nerve. So inferior rectal nerve and also inferior rectal artery. And also of course, as there is a pudendal canal, there will be pudendal nerve, dorsal nerve of penis in male, whereas dorsal nerve of clitoris in female, and also perineal nerve. That is all pudendal canal contains. Pudendal nerve, perineal nerve, internal pudendal artery, internal pudendal vein, posterior scrotal vessels or nerve. This is very important. Posterior scrotal vessels or nerves, and also fat. Of course, lot of fat. So note one important point regarding ischiorectal space is it is horseshoe shaped. Why it is horseshoe shaped? You can see this is called horseshoe shape because the ischiorectal fossa communicates with other side behind the rectum and anal canal. Actually, the ischiorectal fossa of right side, for example, it want to connect with the left side. So then it will form a horseshoe shape to connect on both sides, and it will travel behind the rectum and anal canal. Now here let us check out this diagram. If you see, this is the rectum, this is the anal canal, and on the side here you have the levator ani muscle, and just side to it here you have obturator internus, and this is our ischiorectal space or fossa, and here you will have your pudendal canal. Okay, and this is internal anal sphincter, and this will be the external anal sphincter. So this is how the diagram looks. So if you want to see the urogenital triangle, you can see it here. If you see here, you can see here corpus cavernosus of penis, which is an erectile tissue, external urethral sphincter, corpus cavernosus of urethra. Okay, so now let us discuss the layers of superficial perineal space. Now let us discuss here the layers of urogenital triangle. So if you see the layers of urogenital triangle, so what we are talking, we have discussed this anal triangle, right? So what you have understood in anal triangle, there is an ischioanal rectal space. We have understood its content, and also we have understood that there is levator ani muscle, and there is obturator internus. In between that there is ischioanal fossa, and there is also pudendal, like a canal there. Okay, so all this we have completed. Now coming to this triangle, urogenital triangle. Okay, so in the urogenital triangle, what are the layers? So first, starting with skin. After skin, of course, superficial fascia. After that, deep fascia. After that, you have superficial perineal space. After that, you have perineal membrane. So one thing you need to remember, till the perineal membrane, this is all called as superficial pouch, superficial perineal pouch. This is very important. You can see a superficial perineal space, it is above the perineal membrane. Once you go after the perineal membrane, it is a deep perineal space. So this is a deep perineal space, and this one is a superficial fascia of urogenital diaphragm. So remember, these are the layers of urogenital triangle. First, skin, superficial fascia, deep fascia, superficial perineal space. Next, perineal membrane. So anything after perineal membrane will be deep perineal space, superficial fascia of urogenital diaphragm. Okay. So those are the different layers. Let us try to understand this diagram also. You can see here, this is the male urethra, this is the prostate, and this is the prostatic urethra. This is a prostatic gland, and here, sorry, this is the bladder, right? This is the bladder. Here the ejaculated ducts will open into prostatic urethra. Here you have prostate gland, and this is a superficial fascia. This is the deep peroneal pouch. Why this is deep peroneal pouch? Because this is the perineal membrane. Okay, so deep transverse perineal muscle will be present here, and this is the urogenital diaphragm. This is the urogenital diaphragm. So there is urogenital diaphragm. You can see deep perineal space, urogenital diaphragm. This is perineal membrane. So here there is superficial fascia of urogenital diaphragm, and this will be the perineal membrane. And here you have sphincter urethra muscle on each sides of membranous part of urethra. This is the inferior fascia of urogenital diaphragm, that is the perineal membrane. So this is the perineal membrane. This is the deep space. We have discussed already. Anything after the perineal membrane, deep space, and this is the superficial fascia of urogenital diaphragm. So remember that the superficial perineal space communicates with anterior abdominal wall in front side. So on front side, the superficial perineal space can communicate with anterior abdominal wall. So any infections over here can easily pass through anterior abdominal wall. Now let us discuss about deep perineal space. Before that, you see here some points like sphincter urethrae muscle helps to hold urine. It will control micturition. It is a skeletal muscle. Nerve supply pudendal nerve, which is somatic nerve. So damage to external sphincter urethra results in incontinence of urine. So we are talking about this sphincter, external sphincter, which can control the urine. And next, coming to internal urethral sphincter. It is at the bladder neck. So this is the internal urethral sphincter. Okay, so internal urethral sphincter is at the bladder neck, whereas external urethral sphincter is around membranous urethra. So if you see here, around membranous urethra, you will have external anal sphincter. This is internal. Internal anal sphincter is at bladder neck, prevent retrograde ejaculation of semen. It is a smooth muscle. So internal urethral sphincter is a smooth muscle, whereas external is skeletal muscle, and that is useful for urination, and this is useful for ejaculation. So prevent the ejaculation to the bladder. Okay, so nerve supply autonomic, damage in TURP procedure. What is TURP? It is a transurethral resection of prostate. It is done in the cases of benign prostate hypertrophy, and this will occur mostly in old age. So in old age, if you do this procedure also, if the semen even goes back, there is no problem in the old age. So the most common complication of TURP is retrograde ejaculation of semen. So now let us differentiate the internal urethral sphincter with external urethral sphincter. The internal urethral sphincter is present at bladder neck. It is a smooth muscle. It is supplied by autonomic nervous system, and if damaged, there is retrograde ejaculation of semen. External urethral sphincter is surrounded by at the membranous urethra. It is a skeletal muscle, somatic. If damaged, there is incontinence of urine. Now let us discuss about urogenital diaphragm. We already discussed the layers. It is mainly formed by muscles and fascia of deep pouch. So mainly deep pouch is forming the urogenital diaphragm. You can see clearly here in these layers. Here the superficial perineal space has come. This is the perineal membrane. So you can see the diaphragm, urogenital diaphragm. It is just you can see it is just above the deep perineal space. So deep perineal space mainly forms the urogenital diaphragm. Okay, so deep perineal space forms the urogenital diaphragm. So the muscles which are involved here are transverse perineal profundus. So if you remember, transverse perineal superficialis is present in superficial perineal pouch. As this is profundus, this is present in deep perineal pouch. And sphincter urethra is also present in the deep perineal pouch. So what is sphincter urethra? We have discussed already. It is around the sphincter urethra muscle. It is nothing but our external sphincter, right? External sphincter, which is around membranous urethra. So it is in the deep pouch. And there are fascias like superficial fascia of urogenital diaphragm. Of course, it will be in the deep space. Perineal membrane, it will also be in the deep perineal space, pouch, space or pouch is same. So contents, the muscles are transverse perineal profundus, sphincter urethrae, nerve are dorsal nerve of penis in male, clitoris in female. So dorsal nerve of penis will be in the, it is a branch of pudendal nerve, right? So internal pudendal artery, there are three terminal branches like dorsal artery of penis, artery to bulb of penis, and deep artery of penis. So in the name itself you can see dorsal, deep, artery to bulb. So bulb, so remember like this, for the bulb, for the dorsal, for the deep, all are in deep space. In female they'll just change the name clitoris, that's it. So other contents, some other contents in deep space like in the male, membranous urethra, bulbourethral glands, it is Cowper's gland. Cowper or bulbourethral, they are present in deep space. Membranous urethra is deep space because around membranous urethra only you have your sphincter urethra or external sphincter. So like that you can remember. And in the case of female, vagina urethra, very important, vagina is inside, urethra is also inside, that is in the deep space. So we know that outside the perineal membrane all are superficial perineal space. So what are the contents? Here you have ischiocavernosus bulbospongiosus muscles. So there you have only the transverse perinealis deep muscle, sphincter urethra, right? But here there are different muscles like ischiocavernosus, bulbospongiosus, and superficial transverse perineal. They are superficial, right? So superficial you can see them, ischiocavernosus on the sides of penis, bulbospongiosus which forms the penis, and the superficial transverse perineal, it will be in between the urogenital triangle and the anal triangle. In between you will have a superficial muscle, that is a transverse perineal superficial muscle, okay. And artery, there will be a posterior scrotal vessel, posterior scrotal vessel in male, posterior labial. So posterior scrotal, there dorsal means deep, here posterior, so superficial, okay. And also posterior labial, internal pudendal artery and its terminal branches. So remember, in the deep there are internal pudendal artery, but in the deep, if you remember, in the deep there is internal pudendal artery but three terminal branches. But here also there is internal pudendal artery and its terminal branches, okay. And nerves, posterior scrotal nerve, here everything posterior labial nerve. In a male, spongy urethra, ducts of Cowper gland. So one thing you need to remember, there directly the Cowper gland is present deep, but their ducts are present superficial perineal space, okay. Root of penis, crux of penis, bulb of penis. So penis is finally located on the superficial perineal space, okay. And in the female, vagina, urethra, greater vestibular gland, So remember, in female we have already seen in deep space also vagina urethra, even here you are seeing. And in female especially you need to see Bartholin gland. Bartholin gland is present superficial. And bulbospongiosis, ischiocavernosus, superficial transverse perineum we already seen. And in female Bartholin duct opens into posterior lateral. So where at location, this is important, posterior lateral of vagina. So lateral wall is greater than posterior wall. Okay. So coming to perineal body, you know what is perineal body? In between this both triangles there will be a body here, that is a perineal body. So the perineal body is a fibromuscular structure between urogenital orifice and anal orifice, supports pelvic organ by receiving muscles from various stratum. So there are three stratum: superficial, intermediate, deep. Superficial is bulbospongiosis, and external anal sphincter, STP means superficial transverse perineum. So if you see, all these are all these two are superficial space muscles, right? Superficial perineal space muscle, bulbospongiosis, superficial transveralis, but external anal sphincter is again a deep space muscle. Okay, so this is superficial. Next, intermediate muscles are transverse perineum, profundus, deep part of external anal sphincter. So deep part, okay, that is important. So it is present in deep space. Next, deep are pubococcygis part of levator ani muscle. So if you remember the levator ani muscle, it is actually present in the anal orifice, like in a ischioanal space, right? Levator ani. Uh, in the ischioanal space, so that levator ani muscle is present deep. Pubococcygis part of levator ani. Okay. Next, coming to ischiocavernosus muscle is not meeting at perineal body. This is very important point. Ischiocavernosus, you know, it is a superficial muscle, but it is not present in perineal body. Only bulbospongiosis and superficial transverse perineal are involved. Okay. Next, urethral rupture. So what happens if urethra rupture? Spongy urethral rupture. There will be extravasation of urine, means urine will be going either to penis, scrotum, superficial perineal pouch, or anterior abdominal wall. Because we already discussed that from superficial perineal pouch, contents may go to anterior abdominal wall, so they will also go to anterior abdominal wall. Okay, whenever spongy urethra rupture. Why spongy urethra rupture? Because you know spongy urethra is in superficial space. So all these are superficial structures. You can see penis, scrotum, superficial perineal pouch, anterior abdominal, right? So there is no extravasation to thigh due to fasciolata, no to ischiorectal fossa because due to Colles fascia. Deep pouch due to perineal membrane. As there is perineal membrane, they can't go to deep pouch. So if there is a membranous urethral rupture, now we can understand membranous urethra, it is in deep pouch. So now the extravasation of urine is in deep perineal pouch, also to space of Retzius, that is around the bladder and prostate. And also if peroneal membrane rupture, then urine also go to superficial perineal pouch. So sometimes if it is deep, but it may also go to superficial. So only in case of bladder rupture, urine will also go to peritoneal cavity. So if even the bladder is ruptured, then urine will go to peritoneal cavity also. So what is buck fascia? Buck fascia is a deep fascia of penis. If intact, hematoma is confined only to shaft of penis. Okay. So now let us discuss the pelvic diaphragm. So for that you can see here, this is the pelvic surface of pubis. This is the tendinous arch of obturator internus. This is the ischial spine which give origin to levator ani and is also related to pudendulum. This is the medial side, this is the lateral side. So muscular, actually what is pelvic diaphragm? It is a muscular partition covering pelvic outlet. So you need to don't confuse with urogenital diaphragm and pelvic diaphragm. Pelvic diaphragm is a muscular partition which is covering at the outlet. Okay, it is having two components. What is levator ani? That is nothing but pubococcygis with ileococcygis, and is ischiococcygis. Remember, ischiococcygis is not a part of levator ani. Okay. So this 1, 2, 3 give origin to levator ani muscle. That is pelvic surface of pubis, tendinous arch of obturator internus, ischial spine. All these three will giving origin to levator ani. So what are the subtypes of pubococcygis? Actually pelvic diaphragm of female, if you see in the inferior view, the pubococcygis is divided into puboanalis, puborectalis, pubococcygis proper, pubourethralis, pubovaginalis, puboanalis. So it is divided into many types. Okay, so let us see some features about it. Pubococcygis properis is inserted to coccyx and anococcygeal raphe. Puborectalis is behind the rectum, continue with opposite side and form puborectalis sling. Actually this puborectalis sling will be like this, inverted U shape. Puboanalis blends with anal canal. Name anal canal. Pubovaginal is inserted to perineal body, narrow the vaginal hiatus and prevent the prolapse on either side of vagina. In male, puboprostatic is present instead of pubovaginalis. Now supply of levator ana is S3S4. So levator ana along with ischiocavernosus will form the pelvic diaphragm. So again levator ana is nothing but it is formed by, we have seen here, pubococcygis plus ileococcygis, right?